Hello there, everybody. Today I want to talk a little bit about knee pain. So knee pain is very common, especially in older people, sometimes going upstairs, getting up from a chair, going down an incline can really be painful for the knees. The important thing, again, is that this type of pain is normally easily eliminated because it is generally soft tissue pain, like most joint pain. So some problems such as like not being able to bend your knee, the reason usually is because the muscles here, there are four muscles that attach here below by the kneecap here. And if they're tight, they won't let the knee bend. It's not the knee itself that's a problem. It's the muscles that attach here at the knee that are causing the problem. The same as if you can't straighten it, maybe it's some of the muscles behind the knee. So I get it's another real common problem that I get of people that are scheduled for surgery or have surgery or replacement in one knee and don't want to do that again, go through that again. And normally it's just an easy procedure to release whatever's causing the pain and the dysfunction. Sometimes you have to get a little bit into the ligaments, and they can also have trigger points. But it's generally, at least in one session, you could probably usually get, if not all of it, most of the problem solved. There are some kinds of disorders also. There's one called patellar tracking disorder, which really means that your kneecap, instead of going smoothly over like this, might be being pulled to one side, and so it's scraping. And that's the obvious reason is because as I said, there are four muscles that come in and attach there. And if one of them, which is normally the outside one, is tight, it pulls it out of its track. And so you don't need to cut it. You don't need surgery. You just need to release that muscle. Let's see. Meniscus. It's another common surgery. And there are at least 9 studies that have shown that meniscus surgery is almost never needed. There's one study that compares a group of people, one that had meniscus surgery and one that had a sham surgery that wasn't really surgery at all. Well, they did cut in, but they didn't do anything. And it ended up, both of them were happy with their surgery because it eventually got better, but there was no benefit from the real surgery. The placebo effect was the same. And another one just showed that people that had the surgery and people that didn't have the surgery, after a year, the results ended up being similar. Of course, if you come to me and have therapy on it, you don't have to wait a year. You just usually in one therapy, you can get rid of that pain. There are a number of other factors. Sometimes it's the lower leg muscles that are causing the pain in the knee, but it's almost always not the knee itself, but the surrounding tissues that are tight and causing the pain and causing the dysfunction, not being able to, hurting or not being able to stretch it out or bend very well. So that's just a little information so that hopefully that some of you will avoid having knee replacements when normally, unless you're like maybe over 70 and in poor health, maybe. But if you're not, if you're younger than 70 and you're in fairly good health, you don't need knee replacement for sure. You don't need surgery almost ever. there's certain accidents and traumas that, of course, but this chronic type of pain never does need surgery. So that's my little bit for today. So thank you.